Congratulations on making it to Module 4. We are going to have some review and some deep dive. This is Neurofeedback Foundations, banded frequencies, and other details. Okay, so let's get to our learning objectives. What does EEG stand for? Obviously, a review. What is the 10-20 system? How do we measure brain waves? What percent of brain waves fall between 0 and 30 hertz? What are the 4 banded frequencies that fall between 0 and 30 hertz? What does the Q in QEEG stand for? And exactly what is a QEEG brain map? Okay, let's review. EEG stands for electroencephalogram. It is a piece of equipment that uses small metal discs attached to your scalp to measure the brain's electrical activity. Your brain cells are active all the time, even when you're sleeping. The electrodes capture the electrical activity of the area just underneath the electrode. So your brain produces enough electricity to light a 25-watt light bulb continuously. Just amazing. It uses about 20% of the oxygen and calories that you consume. Amazing. It is an energy hog. So, electrode placement for an EEG. Electrodes are placed according to what is called the 10-20 system, an internationally recognized system of placing scalp electrodes so that data can be compared in a systematic way between clinicians for research and for clinical trials. So there are other systems with other differing amounts of electrodes, but this is the most common, and this is what we use for QEEG brain mapping. Each site has a letter and a number, or another letter in the case of sites over the midline. The letters F, T, C, P, and O stand for frontal, temporal, central, and occipital. Even numbers 2, 4, 6, and 8 refer to the right side, and odd numbers 1, 3, 5, and 7 refer to the left side. Z refers to the electrodes placed along the midline. Electrode placements are obtained by measuring the distance between the nasion, which is right here. It's the notch where your nose attaches to your skull. You can see that. And the inion, which is the knobby point at the back of your skull. 10% of the distance from the nasion to the inion would be FPZ. So you can see that right here. So you take a measuring tape and you measure from the nasion to the inion, and then divide that by, or multiply it times 0.1, and that distance would be the distance between the nasion and FPZ. And then another 20% of that distance would be where the electrode FZ goes. Another 20% would be CZ, another 20% PZ, another 20% OZ, and then that only leaves 10% left to get to the inion, again, the small knob at the very posterior part of your skull. Another line is drawn from the preauricular notch, and the preauricular notch is right in front of the tragus. The tragus is the flap in front of the auricle, and the preauricular notch is just the dip that you feel right in front of your ear here. So a line is drawn from one preauricular notch to the other through CZ. So 10% of the way from the left preauricular notch on the left is T3. You can see that here. And then 20% of the distance is C3. Then another 20% is to CZ, another 20% to C4, another 20% to T4, and that leaves 10% of the distance to the right ear. The skull circumference is measured just above the ears at FPZ, T3, and OZ. 5% of the distance to the left is FP1, and 5% of the distance to the right is FP2, as you can see here. And then going to the right, 10% is F8, 10% of the distance is T4, another 10% is T6, another 10% is O2, 5% to OZ, 5% to O1, 10% of that distance is T5, another 10% to T3, another 10% to F7, and then 10% back to FP1. So say the circumference is 100 centimeters. That would be a very large head, but that's helpful. Then it would be 5% of that distance would be 5 centimeters to FP1, and then another 10 centimeters to F8, another 10 centimeters to T4. So just so you understand. That leaves F3, F4, P3, and P4. And if you measure the distance from FP1 to O1 on the left, F3 will be 25% of the distance up from FP1, and P3 will be 25% of the distance. So you could measure it this way, and it would be 25% of the distance, or you could measure this distance, and these should all be 25% of the way apart. Same here. You could measure this should be about 25% of this total distance from T5 to T6. 25% of the way would be, or halfway between PZ and T6. This is halfway between PZ and T5. Again, this is F3 is half the distance between F7 and FZ, and F4 is half the distance between FC and F4. You could also measure it this way. You'll see in a later video that we typically use caps that properly place all of these electrodes for you. You only need to make sure you choose the right size cap, which is determined by head circumference. So good to remember here, the left side contains odd numbers and the right side contains even numbers. The letters denote the underlying lobes except C, because there is no central lobe, but C is for the central part of the skull. To understand how neurologists and neurotherapists study brainwaves, we have to understand how brainwaves in general work. There are two main properties of all waves. Waves can have different spaces between their peaks. Each time a wave goes from peak to peak, or from the bottom of the wave to the next bottom of the wave, that is called one cycle. When scientists measure waves, they will measure them in the number of times in 1 second you will see a full cycle. This is cycles per second, but it's also called the frequency of the wave, and it's measured in hertz, abbreviated as Hz. The other part of the wave that can be measured is how big the wave is, or the amplitude of the wave. The amplitude is measured from the baseline to the peak, not from the nadir or the bottom to the top of the peak. Okay, so you can see here the amplitude is from the baseline to the peak, not from down here, the nadir to the peak. The unit of measure for amplitude is microvolts. This is true for all waves, not just brain waves. For instance, sound and light are also waves and can be measured in a similar way. So again, amplitude is the distance between the resting position and the maximum displacement of the wave, and frequency is the number of waves passing by a specific point in 1 second. So you can see here, if this entire line is 1 second, this is 2 hertz, or 2 cycles per second. This is also 2 cycles per second because there's 2 peaks in 1 second. Okay. And, but this one is 3 microvolts and this is only 1 microvolt because we're measuring the height of, or the amplitude of the wave. This wave though is 1, 2, 3, 4, 5.5 or 5.25 cycles per second, or we'd say hertz. %90 of all brain waves are between 0 and 30 hertz. These brain waves are broken down into what we call bands. Delta waves are the slowest brain waves, 0 to 4. You can see them down at the bottom, 0 to 4 hertz. And we see these predominate in deep sleep or coma. Theta waves are seen in light sleep, drowsiness, and in deep meditative states. They are 4 to 8 hertz. Alpha waves, on the other hand, are the most sinusoidal and are 8 to 12 hertz. They're seen in a relaxed, calm state, daydreaming, and light meditative states. Finally, beta waves are 13 to 30 hertz and are seen in the busy mind, crunching numbers, driving in rush hour traffic, taking a test. Often we talk about banded frequencies as if the entire brain is transmitting one bandwidth at a time. But the truth is, the brain has a symphony of brainwaves going on at all times. Dysfunction occurs when there is excess power or frequency, or not enough power or frequency in any one band in a particular location of the brain. Okay, so that bears repeating. Dysfunction of the brain occurs when there is too much power or too little power, too high of a frequency or too low of a frequency at any given site in the brain. Gamma waves we're not going to talk about because we don't train gamma waves yet, maybe in the future. Gamma waves are from 30 to 100 hertz. And that's because 90% of the brain waves are found between 0 and 30 hertz in these banded frequencies. All right, here is an example of a 19-channel EEG. And as you can see, there's lots going on here. There are a symphony of brainwaves occurring at any given moment at any given site. As expected, your brain is complex. The Q in QEEG stands for quantitative, not qualitative. We're not looking at the quality of the waves. We're quantifying those waves, okay? Neurofeedback practitioners take EEGs and instead of inspecting them for spike wave deformities, as an epileptologist might do, they run them through databases which contain normal controls for each age and gender, from 2 months to 92, or some even 102. The databases quantify the mean power, the mean frequency, coherence, and phase for each bandwidth at each site. It then compares those to age-matched controls and calculates the difference between the client or patient and the control in standard deviations. That is what you see here. This patient's power, so we're going to look at this. This is put in a table form. So you can see at FP1, this individual's theta waves are 2.2 standard deviations above the mean. At FP2, 2.6 standard deviations above the mean. And at F4, 2 standard deviations above the mean. So this is power scores, relative power scores, and you can see here are where these abnormalities in this individual lies. And then we look at the mean frequency at each site, the frequency of the waves, and the delta power is too big, but we see that the theta power is too big, but we see the delta is too fast. And I'm just going to highlight this one because this really stands out. At FZ, this individual's mean frequency is 4 times the standard deviation. That's a lot, 4 times faster. So this may represent actually slow theta instead of fast delta. And the reason I say that is because I know this client's history. This client is a pre-adolescent. He fell a few times, striking the front and right of his head, and had a couple close concussions and then began having seizures. He was having significant side effects from his medications without adequate control of his seizures. Therefore, his parents sought neurofeedback for treatment to help control his seizures. And good news, as of the recording, he has weaned off one of his medications and has been seizure-free for 1 week. And yeah, this is amazing, an amazing success story. But I bring that up just to highlight the fact that, you know, we're treating the patient, not the numbers. And an intake, which you'll learn more about later in the series, is very important to kind of read what these numbers may mean, especially for the individual. Okay, well, those tables are amazing, but nowhere near as powerful as a color graph. Okay, so our databases take those graphs, those tables, and convert them into a color graph. So the top 5 rows that you see here are from a database called NXLink that was developed by E. Roy John, PhD, which you heard about in a previous lectures. The bottom 2 rows are from NeuroGuide, which was developed by Robert Thatcher, PhD. And this actual card is from a presentation that Bob Gurney gave some years ago on the different subtypes of anxiety. In this example, you can see the 4 black ovals at the top represent normal. So look at the guide on the right. You can see that the colors represent the distance from normal in standard deviations. Okay, so 0 standard deviations from normal is normal. Okay, and as you go up, the power is going to be getting more and more abnormal. So from 0 to 3 standard deviations, or from 0 to -3 standard deviations from the mean. Okay. So black, dark red, and dark blue are all essentially normal because it's within 1 standard deviation of the mean. The further out from normal, the lighter the color. NeuroGuide on the bottom has a guide, but the colors are different. So normal in this scenario down here, you just look at the color guide, it's green. So to continue using the symphony analogy, an epileptologist is looking for that random violin who keeps trying to play like a fiddle every now and again to mess up the whole show. But neurofeedback specialists are interested in the background rhythms, what the symphony sounds like as a whole, so to speak. Are all the bassoons playing too loud or just the ones in the back? Is the flute section playing too quietly or just the flutes in the front? Let's say, for example, the flutes represent beta. If you look at the second row, each column is fairly normal except for the far right oval or head, which is light yellow. Okay, right here, second column. These all look essentially normal, but wow, look at this. This whole entire head is up here at 3 standard deviations of excess beta power. We can see that this individual in this second row has excess beta waves all over their head. So that would mean the entire flute section is playing too loud. We will go into specific biomarkers in later videos, but I'll say here that individuals with this pattern generally report anxiety, depression, and are at high risk for alcohol abuse because it's almost like having a racing brain. And alcohol slows those brain waves right down. The problem is that what might take 2 drinks today in a couple of weeks will take 4, and then a few weeks after that, 6, and then 8. And all the while, the individual is causing brain damage and scarring their liver. So a little side note here, as different practitioners in different countries around the world have begun to practice, they've all asked the question, are the people in our country the same as the people in New York, where Eroy John did this, or Maryland, where Robert Thatcher did his? So are Japanese brains or Swedish brains or Nigerian brains or Ghanaian brains the same as American brains? They decided to collect their own normals and run them through American database. And guess what? Their normals are spot on normal. So it doesn't matter if you speak Swahili or Japanese or Chinese or Tongan or Schweizerdeutsch or French or Italian. A brain is a brain is a brain. Our clinic runs the QEEG through, or the EEGs through 6 different databases. Other clinics who do QEEG brain-based neurofeedback may use only 1 or 2. Some clinics use basic standard protocols, which I do not recommend, and you'll see why later. We do just QEEG guided neurofeedback. So the databases take the power and the amplitude, compare them to controls, determine how many standard deviations away from the mean each brainwave is, and generates this brain map, which is actually a color graph. Brain maps measure electricity in different parts of the brain. And remember, electricity correlates with blood flow. So all functional imaging essentially looks at blood flow, which correlates with brain activity. And I will mention again here, there's a big difference in cost, accessibility, and utility. QEEG brain maps are less expensive, are more widely available, and can be used to develop treatment protocols and research. Okay, so you've also seen this in a prior presentation, but repetition is good when you're learning a new subject. So I want to point out the bottom 3 rows here. In addition to power, as mentioned earlier, neurotherapists are interested in what we call phase and coherence. Coherence is the cross correlation of power between 2 sites. In other words, how similar are 2 sites, say FP1 and FP2, or F3 and F4. And it's irrespective of time synchronization, just how similar do they look. Phase measurement reflects the correlation of covariance in time of activity at the 2 sites. And this temporal relationship can be slowed by damage to the white matter or the communication tracks due to demyelinating diseases, structural or toxic influences, or brain injury. The phase relationship may be faster with increased nerve conduction, velocity, or volume conduction through fluids, and as a field effect. So to bring back the symphony analogy, are the bassoons on the right parietal lobe playing at the same volume or power? Here I'm asking about coherence. It would be typical for a contralateral site to have about the same power. But how about timing? Are the bassoons on the left playing the tune faster than the right or slower? Are all of the instruments playing in time? Now we're speaking about phase. Again, these terms are found when speaking about all waveforms. And we will take an even deeper dive in later videos. But for now, this concludes Module 4, banded frequencies and other details. Here are my references if you'd like to do a deeper dive yourself, which I encourage you to do. And we'll see you for Module 4 quiz. And then Kathy Hendricks will take over and we'll start getting our hands dirty. Congratulations.